Hello and welcome to Social Security Posts, your trusted source for everything related to Social Security, Medicare, SSI, and SSDI. In today's video, we're unpacking a critical update that could impact nearly 70 million seniors and disabled Americans. The new projection shows that Medicare Part B premiums could reach $206 per month in 2026, a number far above what was anticipated. And if this becomes reality, it could dramatically cut into your Social Security benefits and potentially reduce your take-home check next year. We're going to walk you through the key facts behind this projection, what it means for your financial future, and how this change could ripple through your monthly income. If you're concerned about how your benefits will be affected, make sure to watch this video until the end. And don't forget, please like this video and subscribe to Social Security Post. If you have any questions about Social Security, SSI, or SSDI, we invite you to leave them in the comments below. We read and respond to as many as possible to support our community. Now let's dive into what this $206 premium could really mean for your wallet. Just 3 months ago, projections for Medicare Part B premiums in 2026 were around $197. That would have been a $12 increase from the 2025 rate of $185, or about a 6.5% rise. But now, updated forecasts from major analysts are pointing to a much higher number, $206 per month. That's a $21.50 increase, or an 11.6% jump in a single year. This sudden revision has sparked concern among beneficiaries and advocates alike because it suggests that the system may be underestimating real healthcare cost growth. So, what changed in those 3 months? While we don't have every internal metric used in the projection, most experts believe that rising hospital and outpatient care expenses, combined with new administrative costs and provider reimbursements, are putting pressure on Medicare's budget. These costs get passed along to you, the beneficiary, and when the premium changes, it hits your bank account immediately because Medicare Part B is automatically deducted from your Social Security check. The bottom line, this isn't a hypothetical problem. It's one that could take effect very soon. One of the most overlooked realities of being on Medicare is that your Part B premium comes out of your Social Security check before you even receive it. That means if you're receiving $1,200 per month in Social Security and the new premium is $206, you'll only see $994 in your account. You don't get to opt out. You don't get to delay it. It's automatically deducted every single month. And when premiums rise, your net income drops even if you technically got a cost of living adjustment. This setup can create a misleading impression. You might read headlines saying benefits are going up, but in reality, you might take home less next year than you do today. Why? Because Medicare Part B premiums are rising faster than your COLA. So when the Social Security Administration announces a benefit increase, it's often just covering higher healthcare costs, not putting more money in your pocket. This affects not only retired seniors, but also those on SSDI and other forms of disability payments, many of whom already struggle with limited income. The cost of living adjustment is designed to help seniors and people with disabilities keep up with inflation. This year, the projected COLA is between 2.5% and 3%, which would give the average Social Security recipient an increase of around $40 to $55 per month. On paper, that looks like good news. But when Medicare premiums are expected to increase by $21.50, that COLA begins to vanish. The raise you were counting on to pay your bills or offset inflation may end up being mostly consumed by Medicare. This imbalance between COLA and Medicare premium increases is a recurring issue. In some years, the premium rise has completely wiped out the COLA, and in rare cases, even resulted in beneficiaries receiving less money despite a so-called increase. This issue has been widely criticized by advocates who argue that COLA adjustments should be protected from automatic deductions. Unfortunately, until legislative reforms are made, this cycle is likely to repeat, and this year it looks like it could be one of the worst offenders. Let's look at a real-world example. Suppose you receive a $1,300 monthly benefit and you're awarded a 3% COLA. That amounts to an increase of $39 per month. Now subtract the projected $21.50 premium hike, and suddenly that COLA is down to about $17.50. That's assuming you don't have other deductions like Medicare Part D, taxes, or IRMA surcharges, which could lower your take-home amount even more. The result? Millions of people could end up with either a negligible raise or even a smaller check than they expected. And for those on low or fixed incomes, even a small decrease is painful. Rent, food, utilities, these things never go down in price. If your Social Security check shrinks, you'll be forced to make tough choices, skip medication, delay a bill, cut groceries. This is a crisis hiding behind numbers, and it's time we start treating it like one. These changes aren't just about policy, they're about real lives and real hardship. And for many, 2026 could be a very hard year if this $206 premium becomes a reality. Many retirees feel that these rising costs represent a broken promise. They were told that Social Security and Medicare would provide a safe and reliable income stream, but what they're seeing instead is a system that takes just as much as it gives, sometimes more. A 2.5 or 3% raise sounds decent until you realize that premiums are rising by nearly 4 times that rate. It creates a sense of frustration and betrayal that goes beyond just dollars and cents. People are rightfully asking, why does the government give with one hand and take with the other? Year after year, Medicare Part B premiums continue to climb, often outpacing inflation and eating into every Social Security adjustment. There's little transparency, and very few people even realize how automatic and unavoidable these deductions are. This is why so many are demanding change, not just in the numbers, but in the structure of how Medicare and Social Security interact. Medicare and Social Security were both created with the same mission: to ensure that people could retire or live with disability without falling into poverty. Medicare was meant to cover healthcare. Social Security was meant to cover daily living expenses. But now it feels like these two programs are working against each other instead of side by side. When healthcare eats up the COLA meant for daily survival, the system is no longer meeting its basic promise. In an ideal world, COLA would rise with inflation and Medicare premiums would remain manageable or even be capped for vulnerable groups. Instead, we're seeing COLA used as a cost-sharing tool where any increase you get is funneled directly into healthcare costs. That is not how the system should work. If Congress and CMS don't act soon, millions of Americans will continue to suffer from a system that was supposed to help them. Retirees and disability beneficiaries have spent decades paying into the system, trusting that it would support them later in life. But when premiums like this spike, it undermines that trust. It begins to feel like your contributions were more of a tax than an investment in your future. You expect Medicare to be there when you need it, not to become a burden that strips away the few gains you receive from COLA. And it's not just about the money, it's about the emotional toll. It creates fear, uncertainty, and stress. People begin to worry that the safety net they counted on is starting to fray. With $206 premiums on the horizon, many are wondering, if this isn't the worst of it, what comes next? It's a question we shouldn't have to ask in a nation that claims to value its seniors and disabled citizens. While you can't stop the Medicare premium increase directly, there are steps you can take to protect yourself financially. First, during Medicare's open enrollment period, take time to review your coverage carefully. Many seniors are unaware that they're eligible for more affordable or better suited plans. Checking your options each year could save you hundreds, even thousands of dollars annually, especially if your prescription or provider needs have changed. Second, it's important to stay involved and informed. Watching videos like this, reading updates, and sharing information with others can make a huge difference. And finally, consider reaching out to your elected representatives. Let them know how these changes affect real lives. Share your story. If enough people speak up, it could lead to future legislation that decouples Medicare premiums from COLA or puts protections in place for low-income beneficiaries. Behind every Social Security check is a human story, a person who worked hard, paid their taxes, and expected a fair return. When we talk about $206 premiums, we're not just talking about numbers. We're talking about whether or not someone can afford their medication or keep the heat on this winter. These changes affect daily life in very personal and painful ways. It's important that we don't lose sight of that. Medicare and Social Security are not just line items in a federal budget. They're lifelines. And every time a premium goes up, that lifeline frays just a little more. If we don't act, we risk leaving behind the very people these programs were built to protect. And that's something we simply can't allow to happen. Thank you for watching Social Security Post. We hope this video gave you a clear look at the implications of a possible $206 Medicare Part B premium and how it could impact your Social Security benefits. If you found this content helpful, please like this video and subscribe to our channel so you never miss another update. And remember, if you have any questions about Social Security, SSI, or SSDI, please leave them in the comments. We respond to as many as we can, and we're here to support you. Stay informed, stay strong, and stay connected. We'll see you again in the next video.